Councillor Rothschild, Sarah Goodall, Democratic Services. The live stream is now live.
Thank you. Welcome to the 9th and final all-member briefing, reviewing the progress made in delivering the Council's priorities for Cornwall. Today we focus on the service provided to adults as part of our Healthy Cornwall priority. I'm Councillor Rob Rothschild, Portfolio Holder for Adults. For any residents who are joining us online, the Council agreed the priorities for Cornwall at the start of the current administration back in June 2017, a month after the last council elections. We've remained focused on their delivery over the past 4 years. As we count down to the next council elections in May, it feels appropriate to take a moment to reflect on how far we've come in delivering on the commitments we've made to the people of Cornwall, and in particular improving health and social care for adults. That's why these briefings are public facing, so I'd like to extend a warm welcome to any viewers from outside the council who may be watching or listening. In addition to reporting on progress on each of the priorities, these sessions will also reflect on the impact of the pandemic and the opportunities that we need to grasp to help deliver our new 2050 Cornwall plan, together with some of the more immediate steps being taken in the 2021-22 budget. When setting the 5 priorities for Cornwall 4 years ago, we listened to our residents who told us that health and care services were hugely important in making Cornwall a good place to live and most in need of improvement. The council heard that message loud and clear. Our response was to make Healthy Cornwall one of the 5 priorities of Cornwall, and as you can see on the slide, we have worked closely with our colleagues in health and in the voluntary sector to deliver on the priority. The Healthy Cornwall priorities that extend to adults are shown in bold on the slide, namely delivering better health outcomes for everyone, ensuring people are able to leave hospital once they're well enough with the right care in place, protecting and improving the lives of vulnerable adults, and increasing the number of people taking outdoor physical activity. We also agreed a number of measures that would define our success in relation to supporting adults as they are shown in bold on the slide. Reducing the number of people staying in hospital longer than need to because of delays in providing care. Increasing the proportion of working age adults with a learning disability in paid employment. This timeline captures just a small number of the council's achievements since 2017, starting with the creation of the securing of nearly £2 million to help adults with learning disabilities live more independently. I will cover 4 of these achievements in more detail in the presentation, so I wanted to highlight a few others that I'm personally delighted with. Firstly, the Commonwealth project has increased the use of reablement by 75%, enabling more people to live for longer at home. Thanks to our investment in reablement services, we have seen an increase of 11% in the number of older people who are going home after staying in hospital rather than going into care. Average costs of care packages have halved by connecting people to community support and reducing demand. Delayed transfers of care attributable to adult social care have reduced by 40%, lessening the time people are spending in an acute hospital bed. We've improved outcomes for people who experience safeguarding processes and embedding making safeguarding personal. A quality assurance function has been established to support provider and market sustainability. We've created a career pathway and enhanced opportunities for apprentices and trainee social workers. And crucially, we have increased investment in adult social care by over £41 million a year so that we can care for growing numbers of vulnerable and older adults in Cornwall who need our support. A few more of those achievements are shown on this map, which shows the diversity and reach of the projects that we and our partners have been involved in over the past 4 years. I just want to take a moment to highlight a couple of these projects in a little more detail. Our 60 over 60 campaign was a big success and still is, with hundreds of inspirational people nominated for recognition. These individuals go above and beyond in their daily activities to keep active, healthy and support others. A few had bounced back from particularly low points in their life and served to inspire others to seek the advice and take the steps to help them transform their lives. We've also created 100 care apprenticeships in care companies across Cornwall to boost the number of people starting a career in the care profession. For too long, carers have felt undervalued and underpaid, which is something the council has worked hard with partners to address. I wanted to highlight 4 specific achievements that link directly back to our original aims and success measures, and I'm going to spend the next few minutes focusing on, firstly, the Ethical Care Charter, Reablement Services Steps and a new care company, extra care housing, and the Proud to Care Cornwall campaign. In 2018, I was delighted to sign Unison's Ethical Care Charter on behalf of the council, which sets out a series of commitments to protect the rights of home care workers and ensure dignity in care delivery through a consistent, well-trained workforce that enables people to have continuity of care to achieve their personal outcomes. The signing was a benchmark for the future of home care in Cornwall, and the council was leading the way in the South West by becoming the first local authority to sign the charter. By helping set the employment standards through the Ethical Care Charter, the council will ensure the workforce are supported to deliver high quality personalised care whilst underpinning a sustainable marketplace for Cornwall. Crucially, the Charter commits all providers to pay workers the foundation living wage, covering costs of travel time and travel expenditure, and ensure that all care workers receive a minimum number of days training each year and not in their own time. This initiative has had a positive impact on workforce retention in Cornwall's home care sector, where the requirement has been in place since the summer of 2018. Ultimately, this will help to create a stable workforce, and employers can help their people to develop long-term, fulfilling careers in health and care. On signing the charter, we had a fantastic quote from Heather Wakefield, Unison's head of local government, which I wanted to share with you. She said, "Cornwall is to be applauded for being the latest council to sign up to the Ethical Care Charter. The county is leading the way in the South West, and other councils ought to follow the Cornish example of providing better standards for care workers." For several years, CoreServe, through its Cormac subsidiary, have played a key part in providing care in Cornwall, providing a reablement service to help people regain their independence following a hospital stay or other life episode, providing home care services when other providers are unable to do so, and stepping up to work with the council when providers fail and an alternative solution is required, as was precisely the case with the purchase of the Trafula nursing home. Following a review in 2018, the council and CoreServe agreed that what was really required is to develop specialist expertise in the delivery of care services separate from Cormac and establish a new care company, or New Care Co as it's known. The new company operates the Steps Reablement Service, Core Care, domiciliary care services and the Trafula nursing home. In total, this involves around 300 staff and around £10.5 million of services each year. As you can see from the slide, the results are looking really positive. We've invested money in the short-term enablement planning service, known as STEPS, to support people for a limited period of time after a health or social care crisis at home. The annual spend on these services will see an increase from £4.7 million a year to £5.5 million a year. It is proving successful in enabling people to return home from hospital and provide the service they need to get their life back to normal as quickly and safely as possible. STEPS is helping people regain their independence and is now receiving referrals for an additional 2,000 people every year, double the original target of 1,000. That has enabled social work practitioners to redesign processes across Cornwall hospitals with a focus on getting people home more quickly. This has seen the number of people waiting in hospital, despite not needing to be there, decrease steadily over the past 4 years. Like elsewhere, Cornwall has a growing and ageing demographic. At present, 25% of the population is aged over 65, and this is set to rise to 29% in the next few years. And the most significant rise will be in the 75 to 84 age group. Part of the Council's long-term strategic approach is to replace traditional social service responses and reduce the number of people being placed into residential care through the provision of significantly more extra care accommodation. The delivery of extra care housing forms part of the overall transformation of adult services and will be critical in helping to provide the older residents of Cornwall with a viable alternative to moving into a care home. Not only will the extra care accommodation allow people to remain closer to their communities they're familiar with, they will also allow people to maintain their independence for as long as possible. In July last year, we announced the Mears Group had been appointed as our strategic partner to support the development, delivery and operation of extra care housing. Our shared ambition is to deliver a minimum of an initial 750 units with a mix of affordable, rented and shared ownership options as part of a broader ambition to deliver 3,500 new extra care home places in Cornwall by 2025. It is worth noting the indirect benefits of this partnership with Mears, which will also deliver nearly 700 new jobs with a commitment to pay full living wage to workers delivering care and support, and a total investment of £150 million in Cornwall, with £90 million spent on the local supply chain, of which £60 million will be spent on local SMEs. The role of care workers in our communities could not be more vital than it is today. Care workers provide an essential service which has been so apparent during the last 12 months. They visit people in their homes to help them remain independent. They also support them in residential homes. Each carer's contribution is invaluable to helping others live their lives. The small things that carers do make a big difference to someone's life. That is why we launched the Proud to Care campaign to tell people about how rewarding a career in social care and health campaign can be. This was a joint campaign with all our health and care partners, all working together to encourage people to apply for these crucial jobs across the social care and health sector in Cornwall. The new Proud to Care Cornwall campaign, Cornwall Needs You Now, is part of the health and care system's response to the pandemic. For people who are new to care, we created a supportive programme to provide training to work within any care setting across Cornwall, with PPE provided by employers. And as you can see, we set up a recruitment team working 9 till 9, 7 days a week to ensure we had people ready to respond to inquiries and people interested in joining the caring profession. The campaign has been a great success, with applicants coming from retail, hospitality and leisure-based roles, which have been hardest hit by the pandemic. This is all about recruiting people with the right values and attributes, irrespective of their previous experience, and have empathy and a caring nature. We wanted to provide an example on how, through this priority, the Council has lived the values agreed in June 2017. Namely, we listen, we're responsible, and we act in the best interests of Cornwall. The 2017 resident survey revealed that the need to improve health services and care for the elderly were in the top 3 concerns expressed by local people. In response, the Council agreed Healthy Cornwall as one of its five priorities, with the express aim of working with our NHS partners to improve health and care for adults. Over the past 4 years, we've been incrementally transforming adult social care root and branch, with greater integration with NHS services to join up services for residents and reduce the cost of duplication and unnecessary intervention. Since 2017, the Council has increased the core funding in adult social care by £41 million per annum in response to the growing demand for services and the need. We've come a long way, but we're still on a journey of improvement. That said, the signs are positive, and in the 2019-20 National Audit Social Care Survey, over 75% of individuals who responded were either extremely or very satisfied with the care and support services received from Cornwall Council. As members will be aware, I'm really proud of the fact that the Adult Social Care Directorate responded incredibly swiftly to the COVID-19 emergency. We moved overnight to new ways of working with vulnerable adults, putting in place new services to respond to additional demand and building stronger partnerships with colleagues in the private sector, voluntary sector and the NHS. In terms of the specifics, we created 3 community coordination centres and a care bureau, working 7 days a week, bringing health and adult care staff together to coordinate support across the community. We established 125 additional discharge to assess beds in 3 hotels across Cornwall to assist with releasing bed capacity within acute and community hospitals. And we increased the availability of online consultation capabilities to facilitate video consultations and reduce transmission of the virus. We also sourced PPE, including collaboration with Cornwall Foundation NHS Trust to provide mutual aid across health and care. We provided an additional payment for each council-funded hour of domiciliary care commissioned and for each residential care placement in place. We ensured robust virus control measures were in place across all care homes to reduce contagion. And as I've already mentioned, we relaunched our Proud to Care campaign to recruit permanent and temporary staff with different levels of skills and experience to fill a range of full-time and part-time roles within residential and nursing homes, GP practices, community and acute hospitals and people's own homes. The negative impact of the pandemic came through loud and clear during the Cornwall We Want consultation last summer, when residents were asked to reflect on how their lives had changed as a result of COVID-19. 2 in every 5 people said their well-being had been adversely affected, with a fifth of residents receiving help from family or friends during the pandemic. However, the consultation also revealed a number of positive behaviours prompted by the pandemic, which need to be encouraged and sustained to address the growing issue of loneliness among older adults. 73% of respondents feel their community has pulled together during the pandemic, and 56% of residents had helped or supported others in the community, and 1 in 5 residents said they are likely to continue in the future. We reflected on the responses and what that meant for older people and the provision of care and support when we went on to develop our new Gillen Warbath Together We Can Cornwall Plan for 2050. That is why caring for and supporting the older population to thrive feature within 2 of the 6 core transitions of the Cornwall Plan. Healthy, safe, resilient communities. In 2050, no one in Cornwall feels lonely and people live well for longer, enjoying good health for at least 5 extra years of their lives. Cornwall is the safest place in the country, and compassionate communities are helping each other to live, learn and age well. A digital revolution for sustainable living. In 2050, everyone is digitally included and Cornwall is one of the best connected places in the world, making it the natural place to grow great business. Cornwall is at the forefront of using smart technology to help people live well and connect with social networks and services. Our budget for 2021-22 will see the council taking a number of steps towards delivering the Cornwall Plan, and these core transitions by investing an extra 16 million a year in revenue budget to sustain social care services for vulnerable adults and older adults, on top of the 20 million uplift last year. Providing reablement support to over 2,300 people, helping them to live independently in their own homes for longer and avoid going into care. Delivering packages of care to over 2,200 people who are no longer able to live independently at home. Give long-term assistance to over 600 adults across Cornwall with learning disabilities through supported living and shared lives schemes. Providing more joined-up services for residents and reducing the cost of duplication and unnecessary intervention. Starting to take forward the development of extra care housing schemes across Cornwall, and develop new models of care for all age groups, moving away from bed-based residential nursing care to support people of all ages in their own homes. So thank you for listening, and hopefully you found it positive and informative, and now open the floor for any questions you might have through to 1 o'clock. So if people could put an X in the box if they've got a question, that would be really helpful. Excuse me. I'm not seeing anything. Sarah, if I'm just missing something or a hands up, if you could prompt me, please, that'd be really helpful.
Yes, I will do. Yes, Councillor Loveday Jenkins would like to ask a question.
Great. Loveday, good afternoon.
Hiya, not really a question, but I thought you were feeling lonely.
Yes, indeed.
Just wanted to really say, you know, how much the hard work of staff within adult social care has been appreciated over the last year. They have gone over and above, and you know, we get a lot of flack on the council for not doing things, but I do think that we have, you know, worked in a very difficult situation, and the staff deserve some plaudits for that. That's
thank you.
Really.
Thank you. I was clear that the staff in adult social care were working pretty flat out prior to the pandemic. And then, of course, in March last year, you know, the world turned upside down, to be quite honest. And I can't say often enough how incredibly proud I am about the response that our team put out there, because quite frankly, if they were working flat out before, I'm not sure where they got that extra effort from. But, you know, and I said at Cabinet earlier in the week how grateful I am on behalf of the people of Cornwall for that extra effort they put in. There's a price to pay. There is inevitably, you know, you can only work at that pace for so long. And there was a period during the pandemic where we saw our own staffing sickness levels go up. But that's resolved to a great extent now. But, you know, formally, I'd go on record as saying my thanks, not just for the last 12 months, but for the 4 years, because as well as the pandemic, we had the transformation program, and of course what we should never forget is the increase in demand on our services not related to COVID-19 continues to increase year on year anyway. So it's been a phenomenal achievement, that's for sure. But thank you for your kind words, and much appreciated. Thank you. So, Sarah,
Councillor Rand is next. Councillor Rothschild. Councillor Rand.
Thank you very much, Rob. Thank you very much for the presentation. Can you hear me all right?
Indeed, yes.
I just wanted again to thank you and the team for the support that you've given to the Trafula location. Obviously, sitting on the CoreServe board, that is one of the areas that has been a very difficult, challenging situation since the council agreed to take it over, and I was at that meeting where the decision was made. It has been challenging for all sorts of reasons. We know the property itself isn't exactly the right one for the job, and we've had a lot of staff challenges, etc., etc. The building wasn't really fit for purpose, so there's an awful lot of effort that's gone into that. But I'm pleased to say that Alison Waller has been working extremely hard on that, and she has commented on how helpful Helen has been and yourself in supporting her efforts and her staff's efforts to try and get on top of the challenges, which I believe they have done now. So thank you so much. Rob, do you see other moves like that coming forward, given that the government haven't seen fit to follow through on their promise to give adequate funding for adult social care, and therefore pushing the burden via the councils on the local council taxpayer? But do you see, you know, that because it makes that very fragile industry of running those care homes vulnerable to you know, people just pulling out, let's face it, and that would put a statutory obligation on the council to respond?
Yes, thank you, Julian, for that. Crikey, there's 2 or 3 bits. If I deal with the Trafula issue, I had a meeting with Alison Waller and Steve Stevens, the non-executive director for UKECO, last week, And obviously one of the key issues we talked about was Trafula, because what we've managed to do, or what New Careco has managed to do, is stabilise the position. Because if you remember, I'm sure colleagues remember, we stepped in a unique way to resolve the particular problem of what was happening at Trafula. So I think the position currently is that it's stabilised. But your observation about the fitness of the building overall, in terms of the client group that live there, etc., who have a particular set of issues that we need to deal with, it's not the perfect environment. But I will say, watch this space, because I know that discussions are pretty advanced in terms of what's going to be done about that. And it's a bit too early for me to say more than that. But I think there is an awareness of the restrictions of the current building and the need to replace it. And I know that work is pretty advanced in terms of a set of proposals around resolving that particular problem. But hopefully within the next few months, that will be out in the public domain, so you'll know more about that. One of the challenges that I and my predecessors, and I guess my successors, will have is the fundamental problem of the funding of adult social care. Yeah. The Green Paper has been, promised us by successive governments, to be fair, and it's a real challenge. And I know that this year I sent out a letter with the council tax bills, setting out, why are we having to increase the council tax by 3% just for adult social care. And in the presentation, I touched on, it's not just about COVID, but about the demographics of Cornwall increasingly are showing that, the challenge for adult social care gets tougher every year. And I've repeated time and time again my request to, and I've written to the Secretary of State specifically urging that cross-party work on resolving this issue. It's a tricky one, it really is, but I find it very difficult, and the staff do, because people often don't understand why the NHS is free at the point of delivery, but adult social care isn't. It's means tested, and for many people it's difficult to understand, and I get that absolutely. But as long as I'm in a position where I can apply pressure, I will continue to do that, because we do need that continuous funding certainty. Because to be quite honest, we've increased this year the precept by 3%. All that does, it gives me a degree of certainty for the year 2021-22. It gives me no certainty beyond that. And I think the problem that is that you tend to make short to medium term decisions when actually you need to be making long-term strategic decisions. But without the certainty of funding in years 2, 3, 4 and beyond, it makes it very difficult. So I'm hoping that whoever sits in this chair next time continues that, taking an apolitical view, which is what I've strived to do all the way through. Say whichever government is there, please, this must be one of your priorities.
It shouldn't be about party political situation, should it? We know that in Cornwall particularly, we have a statistically proven ageing population, and we're also a retirement destination. Yes. People who've enjoyed time down here think it's a lovely place to come and live, but actually it puts a burden on what is a fairly small council tax paying base. Yes, so indeed. So it's disproportionately heavy on the people of Cornwall in that effect. So can I thank you, Rob, for your period over this council, and as I say, the staff have been amazing, and it's been very, very good from my point of view to be on the Corso board and to be able to support your efforts as much as I can. Helen has been absolutely super. I've had conversations with Helen, and what can we do?
Yeah, thank you very much. I mean, I've been most fortunate, that at risk of embarrassing people, I've got a first-class team supporting me with Helen, Jonathan, Suzanne and Keith now. First class. I couldn't ask for a better team. But Julian, thank you very much. Thank you.
And the next question is from Councillor Funk.
Yeah, Mario, hi.
Hello. Hello, hiya, hello. First, thank you very much. It was a lovely presentation. Loveday has stolen my thunder, but I would like to echo her words and thank you and all social services staff for their sterling work, especially during these challenging times. I've received many calls asking to thank you services. So thank you all for the hard work. It's really very much appreciated by everybody. Thank you very much. Thank you.
Yeah, thank you, Mario. Thank you. I've been in health and social care for a long time, and I don't remember there being a year like the last one. And to be part of kind of response across health and social care has been a privilege, absolutely. But I actually we shouldn't really be surprised about the way that Cornwall operates, should we? And I'm an adopted son of Cornwall. I wasn't born here. But I think actually the kind of response, and I touched on it in the presentation, in terms of the response of our residents saying that whole community feel, that community support is something that they hope continues. But actually, of course, it's espoused in the way that Cornwall responds. Whenever there's a tragedy or a huge demand, Cornwall always responds remarkably well. And I think we've just seen that spirit of one and all epitomised through the response to COVID. It really is, and it's more than reassuring. I can't find words to describe it. That seeing how people, being a people person and worked with people all my life, seeing how people have risen to the challenge and supported neighbours and friends and family members has been exceptional. Really has. But thank you, Mario. Thanks very much.
Thank you very much. Thank you.
And Councillor Wachtel, the next question is from Councillor Kirkham.
Yep.
Hello, just really quick question.
Why am I not surprised?
It was just about Kameneth. You said that increased reablement by 75%. I wondered if that was across the whole of Cornwall or in the areas where they were working specifically. And have you got any figures for actual sort of concrete figures for that? Because it would be good to kind of get those out there a bit.
Yeah, I think it was two parts then. It was in the significant improvement was in the areas where they're already committed. But of course, what we saw that we had plans to extend it, but of course we had to redeploy the steps people into supporting the care, the hotels, beds that we had. So that kind of we'd begun to see the major improvements, and then COVID as ever got in the way. So then we saw a dip in the activity of steps, which we're seeing improve again now. In terms of what I've got to hand to answer your second part of your question, I'll provide that to you separately because I haven't got it to hand, but I'm happy to do that. But I think my observation about steps is that that's the way. That is really steps, reablement, getting into people when they are in that subacute phase of their illness or condition, and helping them to kind of reablement is a good word, isn't it, really, rather than rehabilitation. It's about helping people before their problem becomes acute, and when it does become acute is to get them back home as quickly as possible. Because one of the things that we've seen consistently, and it's not just in Cornwall, it's across the whole piece, is once people go into care facilities for any period of time, almost exponentially their ability to go home again diminishes. So the quicker that we can get reablement services in, the better. And I think it's been a great illustration as well of how we can collaborate, or how we do collaborate with other bits of organisations as well, because that's we've contracted that bit out to New Careco. So it's a really good illustration, and I think it's a good indicator of how that relationship can grow and develop, because there are other things in the pipeline as well that will kind of reinforce that. But specifically, I'll get an answer to the second part of your question to you.
Thanks very much, Rob.
Thank you.
Councillor Wachtel, it's Sarah Goodall. I don't think there's any more questions for you, Councillor.
Oh, crikey. Great stuff. Thank you very much indeed. So thank you all for joining me this afternoon. I have to say it's been an honour to sit in this chair for the last 4 years. And again, my thanks to the staff of Adult Social Care across the piece. Without them, we would be sunk. but also to you guys out there as well. Health Scrutiny Committee have been unanimously in their support to the work that we've tried to do. Hopefully we get it right more times than we get it wrong, but the support for adult social care has been unwavering. So I'm very, very grateful for that. And stay safe and take care. Thanks very much indeed. Thank you.
Thanks, Rob.
Thanks, Rob.
Great job.
Thanks, Rob. Good luck.
Thanks, Rob.
Good luck.
Thank you, Rob.
Thank you.
Thanks very much.